mercy.
This is just a Bretzle. I'm sure the guy who came up with this name was Bretzle. We call it the Bretzle. So roll on to either side, sir. So you're going to have your patient stack sideline, okay? Top side hip's going to come up into flexion. Bottom side hand is going to hook over, or the easier way is to hook under here, okay? Now, you're going to pull the back side hip. Alright, okay? Now, you can stay right here, okay? You can induce a little rotation. Josh is trying to help himself, okay? Pretty good stretch. Or if you want to do this with your patient, you can also help them get into a little bit more hip extension. There it is. There. And we'll just kind of hang right here and stabilize, okay? I can hang here for 5 minutes. I've got all the time in the world. Josh is hoping we don't do this for 5 minutes, okay? But again, what you want your patients at is you want your patients, okay, at about a medium stretch, a 4 or a 5. All right, I want someone at a 4 or 5 intensity for longer duration to get more deformation and creep effect, allowing the tissue to become more elastic. I don't want to put him or her at an 8 or 9 or a 10, because they're going to fight the entire time. And just where you're trying to stretch a muscle, the antagonist is going to fire, and you're just like, or sorry, the same side is going to fire, and you're just going to be like, it's a stalemate. So let them be uncomfortable, but also where they can relax, okay? And as he's breathing, you can also get a little bit more TLC. You just do it right there, kind of like a lumbar pump handle, okay?
Well, guys, I'm feeling right quad, right hip flexor, mid back, left glute, pretty much everything here.
Yeah, so you want to talk about most bang for your buck? This is really good. Now, 75-year-old granny probably ain't going to get into this position. This is patient selection. This is a sports manual therapy course, but you would be also surprised, come out of there, as you're coming out, let's let the patient off, like the lumbar pump handle, bring them into neutral, help them reset. Let's go to the other side, sir. You'd be surprised that as long as there's no contraindications, how many people in their 65 and 75-year-old range can get into this position? Am I going to put them maybe in as much tension and be as mean to them as I am to Josh? Maybe, maybe not. But again, that's because of the evaluation that I've done and you know, seeing what's going on with them. So top side hip, he's hooking up underneath, taking himself into flexion, helping him back here to grab that quad. What happens, Bobby, if they can't grab the quad? Get me a stretch strap, hook it up around the toe right here. They can hold on to a strap right there, however you want to. Okay. There you go. Okay. Here, you're working with females, replacing here. If you want a little bit more hip cuff stretch, just take them down to a little bit more there. You're also going to get what low back muscle that attaches to the posterior part of the iliac crest. Pretty well, very good. This is a really nice kind of everything stretch. Just sit here, hang tight with them. Eventually they'll be able to do it themselves and put themselves in a position of stretch and just breathe through it, okay? Gray Cook's words, not mine. If you cannot breathe in a position, you don't own that position, okay? Make sure that he or she can breathe. And if they can't, because they're panicking, talk them through it a little bit. It's all good.
You can also teach a tech to help a patient out with it.
Yep. That is the